Hi, I'm Joe Newman. I'm a clinical research fellow in pulmonary hypertension in Cambridge, both at Royal Papworth Hospital and the university there. So my foot into the world of pH was originally through COVID research, and then applying a lot of the lessons that we were learning from the way we're doing COVID research into the world of pH. I think the way that we structure pulmonary hypertension, both as a clinical service and then the research side of things in the UK, makes it work really effectively. So it also means you get to know people really well. I think we all work pretty well as a team. I think the immediate thought of research is about drug trials, clinical trials, and that is definitely a really important part of it. But there's so many other aspects to research. So for example, a lot of my research is what we would refer to as observational studies. So we're not doing anything to patients as such, but we're just observing what happens naturally over time. I think that's really important because we're still learning a lot about the disease itself before we start to try and add in new treatments, for example. So different types of research in different areas for different reasons. A trial would suggest that we are trying something new. So that's normally a drug, but it could be some sort of other intervention. For example, surgery. It could be a new diagnostic test, a new scan, or a new type of blood test. But again, it's something interventional that we are doing to patients, whereas the study is a broader term, and again would just cover more observational things where we can follow patients up just by observing. It's a really big spectrum of all sorts of different things. It can be something very simple and straightforward, like completing a questionnaire, a one-off time point. It takes 5 minutes and then that's it, through to a drug trial, which could be regular hospital visits with tests, potentially taking a new therapy which may or may not work, and everything in between that. So it could be testing out new blood tests a couple of times every week. It could be seeing whether a new type of scan works. So there's all sorts of different things. I think it's really important that we're open-minded as to what exactly research covers, and there's all sorts of different things and different ways that people can get involved in that. I think there's an expectation that we as clinicians and researchers offer the opportunity to. So if I'm seeing a patient in clinic, for example, and I think that they might be eligible to take part in a particular study, then I think there is a responsibility to have that discussion. Of course, there's absolutely no expectation for patients to take part. And I think the bottom line that I always highlight with patients is that research is important, but it's always voluntary. And we accept up front that research isn't for everyone, in the sense that sometimes for medical reasons it might not be safe to take part in a particular research study, but also acknowledging for patient reasons that they might not want to, and that's totally fine for whatever reason. So I always emphasise that, and I say that even if they sign up for research on day one, the next day, for any reason or for no reason, they can stop taking part in the research, and that is totally acceptable, no questions asked. There are a lot of exciting things coming up in the field of pulmonary hypertension. I think the one thing that we keep hearing about at the moment is a new drug called sotatercept. So we are increasingly seeing some data coming out of the trials from that looks like it's likely to be quite effective. But we're still waiting in the UK for that to be licensed and go through the regulatory process. And even once that's used in clinical practice, there'll still be a long period where we are still continuing to learn about sotatercept, how it's used in different types of pH, and whether it can be used more broadly perhaps or in slightly different situations. But I think that's a really exciting area, not just that specific drug, but just the concept that we have understood the disease, developed a drug, brought it all the way through to a trial and hopefully into the clinic, and I'm sure there'll be more drugs to follow. It's occurred to me a lot recently that when patients take part in a research study, it's often for really altruistic reasons, because generally they're unlikely on a personal level to benefit from whatever it is that's taken place in that research. They may do, and that's in some respects lucky, and that's good. But I think the real value of trials is what happens in the future. So everything that we have in pulmonary hypertension now, all the drugs and the diagnostic tests, exist because people in the past have researched them and patients have kindly taken part in those research trials, seen them through, and now we have safe and effective treatments. In the same way that patients who take part in research today, I think, are providing hope for patients in the future who will have, again, hopefully better, safer treatments again in the future. So I think it's really important that we recognise the huge contribution that patients make to our research. All of our research, by definition, at some point involves patients in that process. And none of this would happen without patients putting themselves forward to take part in research studies. And we're incredibly grateful to everyone who's taken part.